Aging is a fact of life that comes with wisdom and experience, but also greater health risks. Nursing homes provide an invaluable service for anyone whose family can no longer help take care of them. As of 2022, the Centers for Medicare and Medicaid Services estimate that more than 1 million people reside in these facilities. With so many relying on these services, Dr. Michael Barnett says the constant closure of nursing homes is a big issue. That's not a surprise to those who've been paying attention.
This has been a problem for decades. We have also been kind of collectively, politically uninterested or unwilling to tackle the oncoming issue of a huge bulge in the number of people who will need long-term care as the baby boomer generation very rapidly approaches, their 70s and 80s.
Barnett is an associate professor of health policy and management at the Harvard T.H. Chan School of Public Health. He says that there will soon not be enough beds for everyone who needs one. Policymakers have been trying to find a solution for years, even going back to the Clinton administration. The idea back then was to increase federal funding and support for long-term care.
The problem with it is that it's extremely expensive. And so coming up with a state federal funded solution to that requires funds that, politicians were unwilling to commit to. And so we are approaching a situation where, that care is going to get paid for one way or another. And it's probably going to go the way of other places in the healthcare system where people who have lots of resources will be able to pay, extremely high rates to kind of get their loved ones the care that they need. And many, many people will fall through the cracks and be in a very tough spot.
Many facilities are already struggling with the increased demand. A report published in Health Affairs Scholar shows that an average of 118 nursing homes have closed each year since 2011, with that number slightly increasing since 2020. Barnett says it can be difficult for these facilities to be profitable, even with the increased demand, because many of the long-term residents are covered by Medicaid.
And Medicaid pays very poorly relative to how much those beds cost to actually maintain. This is sort of an endemic problem in the whole industry, the way that it's structured in the US. So the way that nursing homes make money, in large part, their profit comes from admitting people who just need some short-term rehab from the hospital.
Barnett says many of these short-term patients are covered through Medicare or commercial insurance, which is where nursing homes make most of their profit.
And so we have a setting where nursing homes' most important function is the safety net, which is where do people stay when basically they're not safe at home or no one else can take care of them. That's actually their least profitable. That's actually a drain on their financial performance. And so nursing homes do care for those people, and it's very important to maintain quality of care for that population, but it's not their only purpose. The way that they generate profits is through rehab.
So is the fix to all of these issues simply to have Medicaid pay more? Probably not. The other side of the debate is that the industry as a whole needs to be restructured.
A lot of nursing homes are for-profit, and those for-profit chains are doing relatively well. And are, like in any for-profit business, arguably they could be paying their employees more or, treating their employees better. I think that in many markets, it's probably quite likely that in states whose Medicaid programs pay particularly poorly, that nursing homes could likely do more and provide for more staffing if Medicaid paid better. That gets into the complicated political issue of Medicaid funding, and because also Medicaid is usually the single largest part of any state's budget, and long-term care is a very big chunk of Medicaid budgets. So it's expensive.
And the question becomes, who's going to pay for it? Raising taxes is almost always an unpopular solution. And should we be funneling more money into a system that's been having major staffing issues? More funding probably won't be the clean solution we need when these facilities can't hold down employees to provide the necessary services.
Working in nursing homes is extremely difficult. It's a very tough job, and it often pays pretty poorly, often minimum wage or not very far from minimum wage. And we're seeing this play out in a lot of other industries like home health care and other employers for like low-paying jobs where they really can't find people who are willing to do the work. And we would think that that would lead to big hikes in wages, and eventually that labor market would kind of work itself out. But it just doesn't seem to be happening very quickly in nursing homes.
A recent report by the Office of Inspector General found that nursing homes have faced monumental staffing challenges. In fact, every facility that was interviewed dealt with this obstacle. citing burnout as the main cause for the high turnover. And though many industries have 10 more people ready to apply for a newly opened position, nursing homes are struggling to find new staff.
Nursing homes aren't just understaffed because the jobs don't necessarily pay well enough or they're not good enough jobs, but also there's just very few people who are willing to do them. And so even if nursing homes want to try to entice people to come, we have, as a country, we haven't developed a workforce who kind of is well trained and actually prepared to do that work.
So if increasing their wages isn't going to solve the issue, how can we fix the shortage? Barnett believes policy changes, specifically for immigration, could be the answer.
The vast majority of the kind of largest chunk of the nursing home workforce are immigrants. And we also have issues with immigration policy and kind of who is actually coming into states and willing to do those jobs. It's a little bit like the paradox we have with, undocumented immigrants do a lot of work in farm labor for doing menial jobs that American citizens are unlikely to take. And they're actually an essential part of the labor force, but there's also, a lot of political acrimony around what exactly to do about immigration and who can come into this country and work here.
New research is starting to support this stance. A recent paper in Health Affairs shows that while the number of American certified nursing assistants has been rapidly declining since the mid-2010s, the number of foreign-born CNAs has remained nearly the same. In fact, it projects that the staffing shortages during the pandemic would have been much worse if not for the immigrant CNAs staying in the workforce. The research argues that creating pathways for immigrants to fill the staffing gaps will be crucial to the future success of nursing homes. And though more and more people are wanting at-home care instead of being moved into a group home, Barnett says the demand will still exceed our current capabilities.
There's always going to be a large group of people who have no choice, and it's really the only option for them. And we're still going to be running out of beds for those folks. As a primary care doctor, this is one of the hardest things that I have to deal with is my elderly patients who are really quite isolated and don't have any family and friends who are either willing to help them or they are willing to have help them because they often will refuse care. And I think it shortens their lives.
So where does that leave the hundreds of thousands of elderly that will soon need this care? In a perfect world, we'll be able to fix the staffing and funding issues before we're too far into this crisis to recover. Unfortunately, our system is full of bad decisions and missed opportunities. So how can we prepare today for a potentially difficult future?
This is not a problem that affects other people. It will affect you or your family at some point in the future. And all of us have the possibility of becoming injured or so injured or sick that we're not able to take care of ourselves or one of our family members. And I think one of the ways that you can be prepared for this is to actually educate yourself on what it would mean to actually go to a nursing home or, for your older relatives, like what are their options and what do they want? And making sure that's very clear. And if they want something that seems like it might become impossible to provide or very, very difficult, then that has to be a family conversation about what exactly happens.
You can find more information about Dr. Michael Barnett and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.